Okay, today I want to present my presentation slide. This is my first slide. Presentation slide content critical thinking, about the critical thinking lah. So perspective case presentation was this. Should Malaysia increase tax on sugary drinks? Was my title lah. So have second page. You can see the slide about the background of the issues. Malaysia sugar crisis. Malaysia is the fastest nation in Asia who UNICEF 2019 in this year. Okay, 1 in 2 Malaysians adults are overweight or obese. In the report, years 2023. Okay, and then 15.6% of the adult, such as 3 million people are diabetes. Also in this report can find lah, NHMS 2023, diabetes prevalence nearly doubled 11.2% in the year 2011 and until to 18.3% in year 2019. 36% of students consume sugary drinks at least once daily. Average adolescents sugar intake like 10 teaspoons per day, but existing adult recommended limits. Policies context. In the July 2019, Malaysia introduced 0.40 cents per liter excise duty on sugar sweetened beverage, and until next will be this January 2025, tax increases to 90 cents per liter. This is on the budget 2025 lah. At least 54 countries worldwide have implemented similar tax. Despite progress, Malaysia's tax rate remain below WHO recommended levels. This presentation argues, yes, Malaysia should further increase tax on sugar drink. Why I say so? Because that we can see this report about this. After we look in the forms, indicator and the data, we can look about adult overweight obesity rate, such as like 50%, equal 50%, almost lah. And also we can look about this child obesity rate, depend on 5 until 19 years old peoples, was second highest in Asians. Okay, let's talk about this under 5 overweight. Only data just show only 7.1%. Diabetes prevalence 15.6% of adult. Undiagnosed diabetes, almost 50% of all cases. And we can see annual healthcare cost of obesity. We use USD 1.7 billion per or 0.54% of GDP. And we can see our percentage of public hospital deaths from obesity related disease. The data was 73%. How highly? So this is what the serious data. Public healthcare budget spent on obesity related NCDs like 10 until 19%. Might be this budget lah. 4 until 8 billion is billion. Okay, we can see the stakeholders. The governments can do about revenues generation plus public health responsibility. Also, the consumer can do was health outcomes plus price sensitivity, especially B40. Beverage manufacturers, products reformulations, pressure plus profits margins. We can see healthcare systems overloaded with preventables NCD case. Children and young most vulnerable to marketing and consumption habits. The charts suggestions like that. So that was more of my data. Okay, and then we can see second slide. My first slide was issues mapping. Pros and cons of increasing sugar tax. What is the pros? We can see about this. Reduce SSB consumations, 9.25% decline after 2019 tax. And also, the cons was increases consumer price, affecting low-income groups. The second props was incentivize manufacturers to reformulate products with less sugar. But we see the cons was raises operating costs for beverage industry. This also have the cons. And downstairs you can see some props and cons lah. That can also see it. Okay, the key insight was the tax is necessary but not sufficient. It must be part of a comprehensive strategies. And next slide. Slide 5. Main arguments. We talked to about facts and to values to policies. We can see argument 1, public health imperative. What that says so? Scientific evidence is unambiguous. SSB consumptions drive obesity and diabetes. WHO classifies SSB taxation as a best buy for NCD preventions. UK's soft drink industry levy led to significant product reformulations and reduced national sugar intake. Mexico SSB tax resulted in 7.6% decline in purchase within the first years. Malaysia on data show as a 9.25% reduction after the 2019 years. Tax prove its work. Argument 2. Economic justifications. Obesity costs Malaysia USD 1.7 billion annually in direct healthcare costs alone. Indirect costs such as lost productivity and the SM teams add billion more. Okay, again, second point was for until 8 billion of public healthcare budgets goes to obesity related diseases. And also next, tax revenues like 400 million can fund school breakfast programs, health campaigns, and subsidize healthier alternatives. Preventing disease is far cheaper than treating it. Argument 3. Protecting vulnerable groups. Children are disproportionately exposed to SSB marketings. 36% of students drink sugary beverage daily. Higher tax discourage early consumption habits that lead to lifelong health problems. Revenue can fund nutrition programs specifically targeting children and B40 communities. And we can see about next. Sorry, not this slide. Okay. Slide 6, argument. Linking to the facts and values and policies. The fact is, 1 in 2 Malaysians adult is overweight or obese. 73% of public hospital death stems from obesity-related diseases. Let's talk about the value. The value was every Malaysian deserves access to healthcare system that is not overwhelmed by preventable diseases. The government has a moral responsibility to protect public health, particularly for children who cannot make informed choice. And then talk to the policies. Malaysia should progressively increased the SSB excise duty to 1 ringgit 50 cents per liter by years 2027 years. Extend coverage to milk-based and freshly prepared sugar drinks and earmarks are all revenue exclusively for public health programs. Let's see next slide. Slide 7. Counter arguments and refutations. Counter argument 1. The tax unfairly burdens low-income consumers. Refutations. Research show SSB tax have progressive health effects. Low-income communities suffer disproportionately from obesity and diabetes. Reducing consumptions amongst this group delivers the greatest health benefits. Furthermore, tax revenue can be redirected to substitute healthier food option for B40 household, creating a net positive outcomes. Counter argument 2. Okay. Consumer will simply switch the untaxed sugary alternative like Tetarek and syrup bandung. Refutations. This is a valid concern, but it argues for expanding the tax scopes, not abandoning to the tax. WHO and UNICEF recommend extending excise duties to milk bags and freshly prepared high sugar drinks. Malaysia should also lower the sugar content threshold from 7g to 5g, 5 grams per 100 ml for milk-based beverage. Counter argument 3. The tax hasn't solved obesity, it doesn't work. Refutations. No single policies can solve obesity. The tax is one tool in a comprehensive strategy. Like a post 2019 data shows a 9.25% reduction in SSB consumptions. International evidence from the UK, Mexico, and South Africa confirms that SSB tax work best when combined with educations, labeling, and marketing restrictions. The tax is working. It simply needs to strengthen, not abandon. Next slide. Slide 8. Conclusion and recommendations. The summary was Malaysia faced a severe obesity and diabetes epidemic, the worst in Asia. Sugar-sweetened beverages are a major contributor to this crisis. The current SSB tax, 90 cents per liter, has produced measurable results but remains below international recommended levels. Increasing the tax is economically justified, ethically necessary, and supported by global evidence. And my recommendations was increase SSB excise duty progressively to 1 ringgit 50 cents per liter by year 2027. Expand tax coverage to include milk-based drink, freshly prepared beverage, and fruit juice with added sugar. Lower sugar thresholds for tax exemptions from 7 grams to 5 grams per 100 liter for milk-based drink. Earmark 100% of SSB tax revenue for public health, school nutrition program, free health screenings, and subsidies for healthier food. And next point was introduce mandatory front of pack labeling with clear sugar content warning. And the last point was restrict SSB advertising targeting children under 18. And my slide 9. Next slide. Impact of proposals. If implemented, this measure would further reduce SSB consumptions by an estimated 15% until 20% over 3 years, prevent thousands of new cases of diabetes and cardiovascular disease annually, save billions in long-term healthcare costs, generate additional revenue for targeted health and nutrition program, position Malaysia as a regional leader in NCD preventions. The bottom line, a healthier Malaysia is more productive and prosperous Malaysia. Increasing tax on sugary drinks is not punitive. It is an investment in the nation's futures. Last slide. This all my reference link. As can see, have 10 reference lah. Okay, this is all my sharing. Thank you about teacher. Thank you.